An arrhythmia is an abnormality in the timing or pattern of the heartbeat. So when you have an arrhythmia, your heart may beat too quickly or too slowly. Or you may experience an irregular rhythm in which your heart feels as if it's skipping a beat. So today let's talk about the types of arrhythmias. Some types of arrhythmias may not be too serious, whereas other types of arrhythmias may be of a great concern because they can cause fainting, heart failure, or even sudden death. So if you think you have an arrhythmia, you should consult your doctor. Number one, palpitation. So the heartbeat that is cut out of a rhythm occurs when the electrical signals do not originate from the sinus node. Number two, supraventricular tachycardia. So this is the rapid heartbeat involving the atria. There are several types of supraventricular tachycardia which include atrial fibrillation. So these are ineffective contractions of the atria caused by the rapid irregular signals from the multiple sites in the upper half of the heart. Secondly, atrial tachycardia. So this is the rapid beating of the atria. So this is much faster than the ventricles due to the shortcut in the upper half of the heart. Thirdly, atrial flutter. So this is the extremely rapid beating of the atria due to a short circuit in the upper half of the heart. Lastly is the proximal supraventricular tachycardia. So this is a rapid heartbeat caused by a short circuit resuming from an extra electrical pathway in the heart. Number three, ventricular tachycardia. So these are rapid, inefficient contractions of the ventricles. Number four, bradycardia. So this is a slow heartbeat due to a failing sinus node or a blockage in the electrical circuit. But today let's talk about the causes of arrhythmias. So you should know that arrhythmias have very many different causes, but today we are going to talk about the most common causes of arrhythmias. Number one, congenital abnormality of the heart's electrosystem. So some people are born with an abnormal muscle fiber connecting the upper and lower chambers of the heart. Number two, inherited heart disease. So this causes abnormalities over time. Patients with inherited conditions are born with normal hearts, but over time the heart muscle is replaced by a fat and scar tissue which can cause arrhythmias. Number three, acquired conditions. This includes conditions like heart attack, which can cause part of the heart muscle to turn to scar. Scar tissue may be the site of a short circuit and set the stage of ventricular tachycardia. Number four, changes over time. So the heart may change as years pass, eventually developing an arrhythmia. So by the age of 8, 1 person in 10 has atrial fibrillation. So today we're going to talk about the symptoms of arrhythmias. Cardiac arrhythmias may cause a wide variety of symptoms which include number one, palpitation. So this involves the racing, skipping, or fluttering sensation in the chest. Number two, dizziness or lightheadedness. So this comes as a result of disrupting blood flow to the brain. Number three, fainting. So this also comes as a result of reduced blood flow to the brain. Number four, low blood pressure. So this comes after the disruption of the heart's pumping efficiency. Number five, chest pain. So this comes from the reduced blood flow to the heart. Number six, shortness of breath. So this comes from the reduced blood saturation leading to low oxygen delivery. Number seven, fatigue. So this also comes from the reduced blood saturation leading to low oxygen delivery. Number eight, heart failure. So here the heart can't pump enough oxygenated blood through the body. Number nine, cardiac arrest or difficulty feeding. So sometimes arrhythmias are silent, which means that they cause no obvious symptom. So you should go and see your doctor so that they can detect an irregular heartbeat during a physical exam by taking your pulse, listening to your heartbeat, or by performing diagnostic tests. Let's talk about the diagnosis of arrhythmias. So some diagnostic tests take place at the hospital while other tests provide monitoring at home as you follow up your daily routine. These tests include on-site diagnostic tests and in-home diagnostic monitor. Let's first talk about the on-site diagnostic tests. Number one, electrocardiogram. So here wires are taped to parts of your body to create a graph of your heart's electrical rhythm. Number two, exercise stress test. So here ECG is recorded while strenuously exercising. Number three, magnetic resonance imaging, MRI. So this involves imaging of the heart that does not involve radiations and can diagnose certain rare heart conditions. Number four, computed tomography. So this involves high-resolution X-rays that can be performed extremely quickly, which result in very low radiation exposure. Number five, tilt table test. So this involves measurement of the heart rate and blood pressure in response to upright tilt. So this stimulates prolonged standing used to diagnose syncope. Number six, electrophysiology study. This is a test that examines the heart's electrical activity from the inside. It is used to diagnose many heart rhythm disorders. Let's talk about the in-home diagnostic monitors. Number one, Holter monitor. This is a portable ECG that you wear continuously from 1 to 7 days to record your heart rhythms over time. Number two, event monitor. This is a portable ECG that you wear for 1 to 2 months. So it records only when triggered by an abnormal heart rhythm. Number three, implantable monitor. This is a tiny event monitor with a battery life of several years that is inserted under your skin to record very occasional events. So today let's talk about the different treatment methods of arrhythmias. Number 1, catheter ablation. This is a procedure to cauterize the specific heart cells that cause abnormal heart rhythms. Number 2, cardioversion. So this procedure involves delivering a precisely controlled shock to your heart to reset an atrial fibrillation. Number 3, pacemakers. So these are inserted under the skin below the collarbone. Pacemakers deliver regular electrical pulses through thin, highly durable wires attached to the heart. So pacemakers are used to treat bradycardia, heart block, and some type of heart failure. Number 4, implantable cardioverter defibrillators, also known as ICDs. So these are small implanted devices that deliver an electrical pulse to the heart to reset a dangerous irregular heartbeat. These are often used to treat ventricular tachycardia or heart failure. Number 5, cardiac resynchronization therapy, CRT. This procedure, a pacemaker or an ICD, is used to treat certain types of heart failure that are caused by desynchronous contractions. Number 6, your doctor may recommend medications based on your type of arrhythmia. Thank you very much. I'm Muji. Please follow me up, like my video, comment.